Good evening, this is Dr. Thomas Klein coming to you from Raleigh, North Carolina. We are so busy with so many projects. I want to report what's going on with the National Pain Council and with JATH, J-A-T-H Research Consortium. We're going to talk today about dependence. There have been some requests from people to explain what dependence is. Before we do that, we just have some news and things that are going on. Someone wrote in and said, did you know there was a law that prohibits interference with doctoring by the federal government? Wow, what's going on? This law, there's if you want to look it up, that's the law. It's in the Social Security Act. So that means this is for Medicare and Medicaid, but that doesn't matter. That's, a huge number of people. So what this law says, we just got it in a little jacket because it's kind of important. Nothing in this subchapter shall be construed to authorize any federal officer or employee to exercise any supervision or control over the practice of medicine or in a manner in which medical services are provided. Unfortunately, the law 42-1395, that's the way you say that, by the way. You don't have to put USC in the middle. That means United States Code. Those are United States laws. 42 is a chapter, it's a big chapter, and then each subchapter is this next letter, in this case 1395. So you can just plug in 42:3295, and you should be able to get it and read it yourself. Nothing that we say on this channel we cannot support. We do not make flat statements. We do not say things that are not true. So check it out yourself. Next is the CDC has taken its 2016 opioid prescribing guidelines, which are horribly flawed and were used to take 7 million people off their pain medicines. And so what they did is they took their 50-page 2016 and rewrote it so that it's 2022. And they said, good heavens, and the news picked it up, good heavens, it's going to be easier for doctors to treat people in pain. But that's not what's happened. And not only that, these guidelines were published on their own internal newsletter, which means these guidelines were never approved by any medical people. In other words, if I want to do research and I write an article, and I pass it around my colleagues and they all look at it, then I submit it to a journal. The journal then submits it to experts to look at it and make sure it's good, worthy of publication. Then we publish it. That's called peer review. CDC doesn't do that. They just publish whatever they think in their internal weekly newsletter. And then that becomes the truth. There has been no major medical organization that has approved the CDC guidelines, whether they be 2016 or 2020. The problem is they're stuck in 38 states in state law, and they aren't going to revise and update with the 2022. Plus, it's 100 pages. So the longer you make it, the more difficult it is to attack. They kind of protect themselves by making it longer. But the National Pain Council is looking at all 100 pages and will be submitting a report. It's basically the same as before. It tries to convince people not to use the 5,000-year-old opiate-based pain medicines, which the FDA says are the only medications we have available for severe pain. If you don't treat severe pain with pain medicines, or commonly called opioids, you're not treating pain at all. We'll be saying more about the 2022 guidelines. Now, this is these are a comment from one of our members. I think due to the CVS policy, I do think to the CVS has some sort of new policy, or they just harder to fill prescriptions. People at CVS and Walgreens and the big chains are really having a hard time getting their medicines filled because the distributors, wholesalers, are not delivering enough medicine, and they apparently are frightened by the authority of the federal drug police. So we've heard. Needs to be looked into. So the wait times for your prescriptions, which you have to get every 30 days, which you don't really need to do, are longer even though we're jumping through hoops. It's really tough now for chronic pain patients. The treatment of chronic pain with pain medicines is what's called critical treatment, kind of like insulin. You stop a critical treatment and within a day or two, you're going to be worse. So what happens with pain patients is that they just have a return of their horrible pain that has been successfully treated. I don't know if you've read it, but Congress made it easier to treat addiction. The federal drug police are kind of in charge of treating people in pain in the United States. No other country has a DEA or a drug police. They're the federal drug police. So what they did is you would have to apply for a special DEA registration in order to treat people with addiction. It was called an X waiver. Well, the Biden administration very wisely got rid of the X waiver, so you don't have to apply to the federal drug police anymore to treat people with addiction. But then what they did, they said, well, you're going to have to take a course when you re-register that we, the federal drug police, have set up. So doctors are going to have to take a course on opiates set up by the federal police. Imagine what's in that. Okay, this is from the Cleveland Clinic. They are working on a program to eliminate the use of pain medicines after surgery. Can you imagine that? They are so frightened of pain medicines causing addiction that they're willing to operate on people without giving them any pain medicine. I talked to a nurse who worked in the recovery room, and she said that 99% of people, after they've been cut open or had their bones operated on, really do need pain medicines. And here's what the fear is about. We showed this last time, we'll show it again. This is how many people will addict to opiate pain medicine each year. And that's only if you've never had pain medicine. If you've had a pain medicine in the past, your chance of addicting is zero. We'll be talking about this from time to time. It's the genetics. Well, we got a couple of minutes left. We try to keep these to 10 minutes so people don't get bored and leave. We want to present a case. Each week we're going to try to present a case of a person, and we call this the Donkey of the Week case. This is a man who's well known to the person that I talked to. He was a native of Florida. He was a long-distance truck driver. And what happened to the poor guy is he developed a brain tumor. Good Lord. So he goes to a hospital in Bradenton, Florida, called the Manatee Memorial Hospital. He has his brain surgery, and after they operated on his brain, cut open his skull, they gave him Tylenol afterwards. Generally, when people have brain surgery for brain cancer, you give them pain medicine, but they didn't. The hospital did not give this man pain medicine. Manatee Memorial Hospital, Bradenton. So then he's not going to survive. So he goes to Tidewell Hospice, which is set up to care for people at the end of their life. He was visited by his son and his best friend, who stood by his bedside and watched him writhe in pain. The Tidewell Hospice, who takes care of people at the end of their life, would not treat him with pain medicine. When they asked the nurse for some help, they said, well, we don't really have a full-time doctor here. And the doctor said to give him Tylenol and Motrin. This is a terminal patient with brain cancer who was flailing and moaning and in obvious pain. Tidewell Hospice probably billed Medicare for the hospice care. Maybe Medicare needs to look into that. Maybe the state of Florida needs to look into the cruelty of what's happened. That is all the time we have for today, and we'll see you at our next Monday, Wednesday session at 12 o'clock. And please subscribe to the YouTube channel, not because I'm looking to make any money, which doesn't happen that often with YouTube, but we need to get the word out. The job of the National Pain Council is to get the word out. We're researchers, we put out facts. Thank you.